Assalamualaikum. I am here with the new video of the protein synthesis inhibitor of the topic macrolide. Macrolide includes erythromycin, calithromycin, azithromycin, roxithromycin, spiramycin, and the ketolides. Ketolides include telithromycin. This is the general mechanism of protein synthesis inhibitors. Aminoglycosides block the initiation of the translation and causes the misleading of mRNA. Tetracyclin block the attachment of tRNA to ribosome. Then it bind with the 30S subunit. Remaining are macrolides, chloramphenicol, lincosamide, oxazolidinones, streptogramins. These all are bind with the 50S ribosomal subunit. Mechanism of the erythromycin and clindamycin. The macrolides bind irreversibly to a site on the 50S subunit of bacterial ribosome, thus inhibiting and translocation step of the protein synthesis. They may also interfere at other steps such as transpeptidation. Generally considered to be bacteriostatic, they may be bactericidal at higher doses. Their binding site is either identical or in close proximity to that for clindamycin and chloramphenicol, because clindamycin and chloramphenicol also bind with the 50S ribosomal subunit, so they bind with the close proximity with the clindamycin and chloramphenicol. Macrolides inhibit protein synthesis by reversibly binding to the 50S ribosomal subunit. Suppression of RNA dependent protein synthesis by inhibition of translocation of mRNA. Typically bacteriostatic activity, bactericidal at high concentration against very susceptible organism. Their spectrum of the activity are mentioned, but the most important spectrum of the activity is gram-positive cocci, gram-positive bacilli, Staphylococcus pneumonia, Clostridium tetani, and Legionella pneumophila. Calithromycin and azithromycin show cross-resistance with erythromycin, but telithromycin can be effective because it is a ketolide, and all the remaining are the macrolides. It having the activity against macrolide-resistant organism. Lack of cell wall permeability to macrolide is a reason why gram-negative bacteria are resistant to antibacterial effect of these agents. Linezolid are the next topic, and it is also the protein synthesis inhibitor. It is the synthetic oxazolidinone ring. It having the oxazolidinone ring, its spectrum of the activity, it have the gram positive organisms such as MRSA, VRE, and penicillin resistant streptococci. It is bactericidal or bacteriostatic. Basically, it is the bacteriostatic. It is the alternate choice of the treatment for in the case of the MRSA or VRSA. It is not recommended for the MRSA bacteremia infection. Linezolid, it inhibits the bacterial protein synthesis by inhibiting the formation of 70S initiation complex, as it can see in this picture. It binds with the 50S subunit and inhibit the 70S initiation complex. It having the resistance for S. aureus and Enterococcus species because of use of in the case of S. aureus. Pharmacokinetics, absorbed after oral administration, IV preparation, also available excreted by the renal and non-renal route. No dose adjustment required in the renal and the hepatic dysfunction. ADR, thrombocytopenia, if it is given with monoamine oxidase inhibitor, then it causes the serotonin syndrome. Limited use are recommended. Why? Because it can precipitate out optic neuritis. when use is more than 1 month. That's all from the topic. Thank you so much.